Even the test kits actually are very specialized. You have to get them all the way from Netherlands, right? And then there's the curative aspect, which is actually spraying with some form of pesticide the area where these flies hide. So the CHP is actually even instrumental in carrying out the spraying. You know, we have to give them knapsack sprayers. We are using the CHPs to go to the villages that have been affected to find out where the patients are and coordinate with the ambulances so that they're brought to a treatment center. So the CHPs are very useful. They're very useful.
Even for this Kala-Azar, we are not sending the sample to either Nairobi or any other part of the county. We are doing it here because of that, the machine, the molecular lab that has PCR. The only challenge we have is we have few test kits which are not locally available. We are sourcing them from Netherlands and so on. But the few that we have received, we are able to do it here. For this Kala-Azar outbreak, most of the patients are coming with low platelets. So if we could have had sufficient storage of platelets in our lab, in our satellite blood bank, we'll be able to save life. Most of the patients are coming to this main referral hospital because we have few test kits. And remember, as I had said earlier, the test kits are not locally available, they are few. So instead of distributing to all over other areas, we decided we bring most of the patients who are severely ill to Wajir County Referral Hospital so that we can be able to maximize on the use of the test kit. So far we have line listed 550 cases. In Wajir County it has affected 4 sub-counties. That is Wajir West, Elas sub-county, Tarbaj, majorly Kutulo, Wajir East in Korofarar, and also part of Wajir North, although the one for Wajir North is not there, but basically the areas that are mostly affected is Elas and Wajir West. So far we have 85 patients admitted at the Wajir County Referral Hospital. We have 18 who are pending to be investigated because still we don't have the test kits. The ones that we had, we have already depleted. So, but the clinician and the consultant are also managing patients based on clinical presentation. Once a child presents with fever more than 2 weeks and the child has hepatomegaly and splenomegaly, that child is started on treatments. Most of the patients who are coming, who have lost their lives, are patients who are brought when they are very, very sick, very, very ill. Actually, there's a child who was admitted immediately within 30 minutes. Most of them, they succumb because of anemia, staying at home, you know, and so on. And the age group that are affected are under 5. That is why actually we are getting high case fatalities because remember, children have low immunity, so they cannot be able to fight any invasive microorganism. Actually, I call this Kala-Azar as a pandemic because the severity. Yes, like in 2017 we had 1,500 Kala-Azar line listed, but the severity was not as it is now. So I think we also expect more support to come. We have written proposal, we have talked to well-wishers to come and support us, and I'm sure more support in the pipeline. Thank you.
There is a sharp rise of Kala-Azar or visceral leishmaniasis in the county, more so in Wajir West and Elas sub-county. The cases are more in Elas and Wajir West. But this disease is endemic in Wajir County from the time it was detected in 2001, around 2005, 2006. But the disease has risen recently after the long rain of December El Nino 2023. There are more cases and some deaths reported in parts of Elas sub-county. The indoor household spraying and fumigation is targeted both Wajir West and Elas, not only Elas. And many households will be reached. Households we are targeting around 4,000, 5,000, 6,000 households in this sub-county to spray.
Sawa.
Umefika sasa. Tunashukuru. Kwanza madam anafaa aende apumzike.
فين قعدت؟ فين قعدت؟ ساتة ما في عندك؟ ايه؟ ما في عندك؟ Angalia maji si mtawaletea. Yana maji. Hata ukinutulisha na. Kwa hiyo yani hicho fedha weka mbili yenye unajua sio? Umechukua unajua nini watoto wapewe. Wakina mama wakipoa wanaenda. Dada.